guys, this is Dr. Hub. Today we are going to look at the stages. What is the stages of the ASOM? So what do we mean by ASOM? It stands for the acute, suppurative, otitis media. Now let's look at the topic. So here first we start with the stage, that is a tubal occlusion. So there is a stage known as a tubal occlusion. So what is a pathology? So pathology states that the ET block, so there is a ET block, it is greater than that of the retraction of the tympanic membrane. And what are the symptoms of this tubal occlusion? So the symptoms is it presents with there is a mild earache as well as there is presence of deafness. Next is we will look at the signs. So these are the symptoms. So what happens to the sign in case of the tubal occlusion? So looking at the signs, there is a retracted. There is presence of a retracted TM as well as they can be CHM. So the treatment of the tubal occlusion will be by administrating the decongestants. Now let's move on to the second stage. So the next stage will be nothing but the pre-suppuration. So what is meant by the pre-suppuration? So the pathology is nothing but there is an invasion of the microbes. There is invasion of the microbes. And what are the symptoms? The symptom is that there is a throbbing pain. There is a throbbing pain as well as there is deafness and there is presence of fever as well. Now let's look at the sign of the pre-suppuration. So the sign is that it can include there is a cartwheel TM, there is cartwheel TM as well as there is CHM. Now let's look at the treatment aspect. So how do you treat the pre-suppuration? The treatment, if you see, it is by the addition of antibiotics. It is by addition of the antibiotics. Next is we move on to the suppuration. So what happens in case of the suppuration? The suppuration, the pathology is it includes there is exudation and next also the pus formation. Exudation as well as a pus formation. Now what are the symptoms of it? The symptoms is that there is an excruciating earache. So there is an excruciating earache, there is deafness as well as high temperature. What are the signs? The signs it includes there is a bulging of the TM. So in suppuration there is bulge of the TM and there is presence of pus as well. Next there is also accompanied with a CHL. Now how do you treat this? The treatment of the suppuration is by so how do you treat suppuration? It is by add the myringotomy. So add the myringotomy and to drain pus and to drain the pus. Next will be the resolution. So what happens in case of resolution? So in terms of resolution, the TM it ruptures. So resolution is for R, that is there is rupture of the tympanic membrane and the pus, if you see, it drains. So it involves the draining of the pus. So what are the symptoms? So the symptoms is that there is a ear discharge, there is presence of, this is all in resolution. So in resolution there is ear discharge and the patient feels better, he gets better. Now let's look at the signs. This is of resolution. So in terms of signs of resolution, there is a perforation. So there is a perforation and it is in the AI, that is the anterior inferior quadrant. Next comes the CHL, it improves. Lastly, what is the treatment of the resolution? So the treatment here will be by, there is ear mopping, and this is with the decongestants and the antibiotics. So there can be decongestants as well as the antibiotics. So all this can be given. So let's look at complication. So in terms of complication, it is due to the virulent organisms. There is virulent organisms as well as there is poor immunity. So there is the mastitis, this presence of mastitis. Next there is infratemporal. Then comes the intracranial and complications. So this was about the stages of the ASOM, that is acute suppurative otitis media. We saw the stages. To name a few: tubal occlusion, suppuration, complications, resolution. To learn and grow daily like this, please do subscribe.